You're watching a special edition of the Wellness Hour. Today, extreme smile makeovers. According to my first guest, your teeth and gums are never too bad to have the smile you've always wanted. We're talking about full mouth rehabilitation. With us, we have an expert on this topic. Had him on the program a couple of times before, Dr. Tyler Tolbert. Dr. Tolbert, welcome to the program.
Well, it's good to be back. I really appreciate you having me back on, and I'm just so excited to talk about all the new things that we have going on.
Okay, good. Now, you brought a stack of photos. So we're going to try to get to as many of those as possible. Mm-hmm. Now, for people that aren't familiar with that term, full mouth rehabilitation, full mouth reconstruction, give us kind of a working definition of what that means.
Well, sure. I mean, that's a bit of a clinical term, I think, but in broad strokes, what we're doing is, we're not necessarily trying to fit everyone into the same box, just going in and taking out the rest of someone's teeth and putting in implants and just giving them a whole new smile. We absolutely do that day in and day out. It's one of the most rewarding things that I do. But the reality is that not everybody that comes into my office and is looking at a difference, that's not always going to be the solution for them. We're not fitting everyone in the same box. What they're coming to me is a new smile, a new life, a new turning point, and we have a lot of different ways of getting there. So sometimes that comprises a combination of procedures, and that's really what that.
So like saving teeth, when we talked about this before we came on.
You got it.
So if you could save teeth, you're going to do it.
I have no problem saving teeth. If they're still good, they're going to stay right there, and we're going to help you maintain what nature already gave you.
Because you've been on the program a couple of times, what's new? What's changed? Because you say a lot has changed.
I certainly can, because the technology is always advancing, and it allows us to do things more efficiently for more people. And so what I've had the privilege of doing is helping out so many hundreds of more people since just the last time I was on here. And so that's given me so many more opportunities to see those stories, see the changes that can be brought about from this. And so for me, I'm just seeing the magnitude of the effect that we can have on these people.
It's that big for these people?
Absolutely. I mean, a lot of people will tell the story of their lives as before they got their teeth done and after they got their teeth done. And
wow.
They might not be the type of people to understand the importance of teeth prior to this process, but they're certainly champions for teeth afterwards.
And there's really that many people that hate their smiles, or like never smile, I should say, or can't eat. I mean, it's like a big thing out there.
For sure, for sure. I mean, my average patient is not walking in, beaming with their smile, trying to show that off. They're looking for the opportunity to do so because, they may have been able to do it once, or maybe they never felt confident with their smile. Okay. And so coming to a place that can give them that is a really special opportunity, and we feel very fortunate to offer that.
Now, the things we're talking about today is something that you teach other dentists.
That's right.
In fact, you have your own podcast.
Yes.
Helping dentists with the clinical part of all of this. Is
that
right?
Yeah, that's right. It's a small, humble podcast to a very niche audience, but I'm very passionate.
It's for dentists, not for the public.
Exactly. It's for dentists.
Okay.
Not a ton of us doing things like this, but I felt it was important that, in a world where things are always changing and always improving, we're always having new options, to keep other dentists up to date on that and make sure it's being done well. There's 20 million people, really just in my part of the country that really need this to get done. And nationally, I think we're doing maybe 30 to 35,000 of these cases a year. So as dentists, we're really failing at, trying to help people with this transformation that they can be having. So I want to help democratize that. I want to help other dentists be able to do this competently, do it the right way, and not take any shortcuts. That's the biggest thing.
Now, when you say somebody comes in with lots of things going on and you fix them with a combination of procedures, that typically you might, at a typical office, you might need to be sent out to several specialists to do what you're doing. Can you elaborate on that? What does that mean?
Yeah, absolutely. So that really is kind of the mode of the way this has been done for a long time. Patients are going all over creation, talking to different specialists, different dentists that, it's not always entirely clear who's the quarterback in those situations. And there's many specialists doing many different things, and getting everything copacetic to begin with the end in mind can be a real challenge.
So you brought it in-house? Is that?
Exactly. So we brought it all under one roof, so that way the plan from the very beginning is carried out all the way through to the end.
One person.
So I strongly believe that every treatment plan has to start with the end in mind. You have to have that vision from the very beginning, and the person carrying you out throughout that process should be responsible for every step.
Okay, now, I've seen a few before and after photos of my time, and you showed me a couple in the green room, and the teeth look really good.
Yes.
How much of that is the way you guys are doing it?
It's everything.
Or the design. Or are you involved in this?
Absolutely. So it really is everything. I mean, when I first came out, we were doing things the analog way. And basically what we were doing is we were just having all these preset teeth and molds and just trying to figure things out and fit it to the patient. That doesn't happen anymore. Since we started doing things the way we do it, we don't make two smiles the same. Everything is customized to the person. Every smile is as unique as the person that we're treating. For years, we were giving the same smile to a 45-year-old man that we were giving to an 80-year-old woman. And these, what actually makes sense functionally, aesthetically for every person is going to be different, and our workflow reflects that.
Okay. Now you brought photos.
Sure.
What are we
absolutely.
looking at here?
All right. Well, right here, I want to show you Aisha. So Aisha is a small business owner. She had recently started a cafe, and she was the owner-operator of it. She was trying to get things going. Of course, she's owning it, she's running it, and she's serving coffee to people. And one day, she actually got a really bad Google review because one of the customers thought that she was being rude. They didn't smile. She wasn't making eye contact with them. Yeah, that's right. And so, you know, it really is a shame because here's a person just trying to get
she's not smiling, and they gave her a bad review.
Right, because the perception was, the judgment was that she was grumpy. She wasn't having a bad day. She wasn't happy to see a customer. And, you know, of course she is. I mean, it's her business, right? And so when she came to me, she's talking about this review, and I can almost, not that I empathize with it, but I can almost see what that reviewer was talking about. She couldn't make eye contact with me.
Is that right?
She couldn't smile fully. I like to say she was protecting. She was hiding something from me, and that was her smile. She was covering her mouth. She was looking away.
So you could spot it.
Oh, I could spot it from a mile away because this is what I see all the time. But I think as humans, we're innately wired to look for that smile. We're looking for warm characteristics. We want to know that the person we're talking to is safe and trustworthy. And she wasn't exactly exuding that, even though I could tell she was a genuine, beautiful person on the inside. So when I see things like that, I get super excited about the changes that I can make for a person, the ones that they perceive and the ones that they're not aware of yet. And that's kind of a surprise they find out along the process. So, you know, when you look at her smile, you know, obviously the things that everyone sees are you know, they jump out at you, right? There's missing teeth, there's spaces
I mean,
here.
was she walking around like this, or she had like a flipper that goes in and out, or what was that?
Actually, I'm glad you asked that question. So of course she had a flipper, right? So it, you know, it would replace a few of those teeth that were showing in her smile. Problem with it is it was made with those old denture teeth, right? It's not very functional. You're not going to be eating with it. In fact, a lot of people will actually take their flipper out to eat, so forget about eating in front of people.
Okay.
And then on top of that, she owns a coffee shop. These things are staining all the time, right? So they're looking different from her other teeth, and things are just looking very unnatural. And so she either has this kind of dysfunctional looking flipper in, or she's, you know, partially toothless. And neither of those were really how she was wanting to show up in the world. So we wanted to give her something that wasn't going to be coming in and out, that was going to be there all the time, that was going to fill in these spaces and give her a wider, fuller, brighter smile to help improve her own perception of herself, everyone else's perception, and even the perception of her business ultimately. And as she's talking, I get excited because she has no idea how good this is going to be. She's thinking,
what do you mean? What do you mean?
She's thinking about a 1-star Google review. She's thinking about that one bad day that she had, but she's not thinking about all the meals that she's missing out on. She's not thinking about eating in front of her friends and family again.
Okay.
She's not thinking about all the great things that are going to come about functionally, what she's going to be able to eat and how much she's going to be able to smile. She doesn't know that yet, and I do, and I keep that secret for a little while. But man, when it comes along, it's just it's a really exciting thing.
So what did you do for her?
So we did a combination of procedures to restore her smile, or to restore her face, how everything fits together. Now, she did have some affected lower teeth as well, and in a lot of places, those would have been toast. They would have, you know, taken care of it, but, you know...
Meaning they would have removed them?
Absolutely, yeah, they would have taken them right out.
So you saved those
for sure,
teeth.
absolutely. So, you know, in our world, you know, artificial teeth and natural teeth can live copacetically whenever that's appropriate.
Okay.
And for her, I could see all these changes that we could make without taking away what she still had naturally. She still had some mileage there. She still had more to enjoy from her natural teeth. So we wanted to preserve that. And as you look here, you know, first of all, she has a wide, bright smile. But just without even looking at the details, would you say that that is a more attractive person?
Yes.
Right. Well, that's what happens to everybody that gets this done. It's not just her.
Okay.
Because we're not just filling out the smile.
She does look better, yes.
Absolutely. We're not just filling in spaces. We're changing. If you look at the subtle changes from the distance from her nose to her chin, that's opened up a little bit more. We've actually...
How does that happen?
Yeah.
Like in her after, she looks a little more youthful.
Right. And I didn't even have to touch the bottom teeth for this, right? So I actually was able to open up that bite a little bit and restore some of that dimension, because what happens is you lose teeth and your face actually shrinks this way, which is a natural thing that happens as we age as well. So if you have it happen, no matter what age you're at, you're going to look 10, 15, 20 years older. So when all it takes is restoring those upper teeth, or maybe both, to open that back up, we're reversing time. We make this person look so much more youthful, so much more vibrant. And that's absolutely what happened.
What's that like when they look at themselves in the mirror for the first time?
You know, it's a funny thing, because I think every dentist, they want this explosive, tearful moment right off the bat, and we're all just anticipating that, and we're filming it. But a lot of times what happens is it's actually quiet. And there's still a little bit of that protectiveness, because they'll smile and they see it for a second, and then they're almost abashed by it, you know, because they don't know what to do with it yet. They don't know how to be a person that has this perfect smile. They don't identify as that. It just happened, right? And so a lot of times that sort of, you know, miraculous after moment, I don't get it that first day. I say, hey, you know what? Go home for a bit, go talk to your friends and family, go spend some time. And what happens is they start getting these compliments, right? I mean, you can't really hide a smile like that, no matter how much you try, right? And so they start to brighten up a little bit more, and they start to actually expect those compliments after a while. And that's something they've never been able to do, right? They would have never expected to get.
Are they taking more selfies and things like that?
They're taking selfies. Their social media is changing. They've got all these followers.
So the vibe of the coffee shop has changed in a way, based on what you're telling me.
Yeah, absolutely. I mean, that coffee shop was just another coffee shop because the person that was putting their heart and soul into it wasn't really bearing their heart and soul. And now she's able to do that. So, yeah, she shows everybody that walks through the door just how happy she is to have the opportunity to serve her customers, and they can feel that too. And I think the Google reviews are going to start turning up a little bit too.
Now, you have one of the offices, and correct me if I'm wrong, and I know there's no definition or recognized specialty as a super specialist. I had an oral surgeon said, Randy, these new general dentists, they do everything right there. It's impossible to compete with them. And so is that, in other words, rather than if it's a root canal, going to the endodontist or going to the prosthodontist for crown and bridge or whatever, you kind of have this, and I don't want to put words in your mouth, but you kind of do it all right there.
Right.
Is that right? And that's by design.
Absolutely, because I believe that is really a portal to better care for patients. I mean, people want things done in a comprehensive manner. They want things to be coordinated in a way that makes sense from start to finish. And the only real way to do that is to do it all in-house. And so, I became the doctor that my patients needed for that process to be optimal. And I think here in Tacoma, I mean, let alone the state of Washington, we're practicing this as the highest standard of care. And that's something we take a lot of pride in.
That's very nice. Okay, time for a few more photos. What are we looking at? And these are all full mouth reconstruction,
yes, sir.
Full mouth rehabilitation, extreme smile makeovers.
Yes, sir. So I wanted to introduce you to Derek. So Derek is a middle school teacher and a father. He always says he's a father first, and he's a great guy. You can tell in his before picture he doesn't really have a problem smiling. There's not really, he doesn't seem to be quite as concerned about his missing teeth as maybe a dentist would be, perhaps. And so for a minute there, I was kind of curious about why Derek was all of a sudden concerned about this, because he's telling me he's been having issues since he was a child. There's childhood cavities. He lost a lot of teeth kind of early on, so there was already that sort of disregard for his teeth. But he still became a teacher. He got educated. He works at school. He's a great teacher. His students love him and everything. And so I'm starting to think, well, what was the difference? What made the change? And then he tells me that he was reading his daughter a story at night, and it was one of those children's books that's kind of it's supposed to teach you good habits, right? This one's about brushing your teeth. And so, it's going on and on about how you have to brush your teeth, you're going to lose them or something like that. And then his daughter's like, well, Daddy, I'm not worried about that. You don't have teeth, and, you're great, you're fine. And that hit him all of a sudden because, that is the kind of thing that creates generational dental neglect, right? So many patients, when they have bad teeth, they're telling me the story of how their parents had bad teeth and their parents before them. It's a generational genetic thing. But it's not just genetics. It's how that's being prioritized in the home, and our children are watching us all the time. So
that was his tipping point. He
had
enough.
Yes, he said, you know what?
He tells you this on the consult?
In the consult, you'd be amazed at how people open up to me. And I think it's because maybe they haven't seen a dentist in so long, they just never unloaded on somebody. There's a lot of decades of time and experience to kind of give to me, and I appreciate it every time they do. And so he's telling me the story, and I realized that was the tipping point for him, is he realized that he could do better for his daughter by being a better example and prioritizing.
So what did you do?
Health. So, of course, through a combination of dental procedures, we were able to completely restore his mouth. So we were tackling issues on the upper and the lower, and we got him to a place where no longer was he smiling with all these gaps. He could show his daughter what good care he was taking of himself, and show him that it wasn't too late in his life for him to prioritize that, and was able to kind of reinforce that she needed to take on those habits as well. And so now he's not feeling abashed about how he took care of himself early on in his childhood. He's able to break that sort of generational cycle that can really happen, and that was a really beautiful moment.
And he's more handsome, that's for sure.
There's no question about it. I mean, you look at this guy, he doesn't...
You say that's everybody. Everybody looks better with teeth.
Everybody looks better with teeth. That's an axiomatic thing. It's 100% of the time. No one ever looks better in their before picture than their after. That much is absolutely a certain. And so for him, he was dressing better. I don't know if you can tell in his before picture, he was wearing a hoodie. This time he wears a button down, and it was just, a casual afternoon. But, he was dressing better. He was making more jokes up front, and he was showing up as a better person. And then, he tells me about how things have changed at school. He thought that, the teeth weren't really getting in the way of how he was being a teacher, but they were, because he wasn't being his best self. He wasn't smiling quite as much. He wasn't wanting to eat in front of people because he had bad breath and, periodontal issues and things like that. And so there's always the immediate problem to get someone to show up, but there's so many other problems. The bad breath, the judgment that they're getting from people, how other people are, treating them, that change almost instantly, and they're having to catch up and process all these new things. And so at this point, after so many transformations and changing so many lives and see what that does, I want people to see us as the place that you go if you're having issues with your gums, you got bleeding gums, you got bad breath, you're having issues eating. Understand, this is a fixable problem, and we're doing this right here.
Like, you want to own the problem.
I own the problem. This is something that I take it upon myself.
Like FedEx owns overnight delivery.
Just like FedEx owns overnight delivery.
When they think of a bad teeth and gums, they think of you guys.
Yes, and Amazon Prime will get it to you in 2 days with free shipping and things, and we're going to fix your smile.
Now, when you're doing these like full mouth makeovers, at the very beginning of the show, I said that you said that your teeth and gums are never too far gone, I think I said,
right,
to have the smile you've always wanted. Do you believe that?
I do believe that, because there's so many different ways that we can take care of a person.
Okay.
If you only have one hammer, every problem's a nail, right?
Okay.
But here, when it comes to the extreme smile makeovers, the full mouth reconstruction, we have a lot of different ways to approach a problem. And so every person, we're trying to figure out the most intelligent way to go about it and give them their lives back without just fitting everyone into the same box. So yes, I do believe that every problem can be solved.
Most of the things you're doing, they didn't teach you in dental school? Is this what you learned after? With continuing education?
Absolutely. So, in dental school, I learned how to be a good doctor, an ethical doctor. I learned how to do the basic foundational things and take good notes. But ultimately, the techniques that are required to be able to do care at this level are just not being taught in schools, right? Just by the design of how everything works, they're teaching you how to do dentistry from 20 years ago. And granted, that's at a very high standard. But you couldn't do what you do today.
I think you told me you travel all over the U.S.?
Yeah, you got it.
To learn this?
Yeah.
Even out of the country?
I've been all over the country, and I've been out of the country. A lot of these techniques actually originated out of the country, and a lot of those early studies kind of came from those places. And so I wanted to learn these techniques from the places that they came from, because that's going to have the longest term follow-up. They're going to see what happens in the long run and how these things really age when certain things aren't paid attention to in the process. So that experience has given me wisdom far beyond my years, and I know how these things go, not just on that delivery day, not just on the congratulatory day, but 5 years, 10 years. I see what that follow-up looks like, and I know how to prevent issues from coming up from the very beginning.
Very nice. Time for some more photos.
Absolutely. So I want to introduce you to Evelyn. So a lot of my stories are kind of occupationally based, right? They have a lot to do with, what people are doing on a day-to-day basis at work and how they want to show up at work and things. It was very different for Evelyn, because she's retired, and for her, she is the cook in her family. So whenever there's big family gatherings, a holiday, what have you, she's the one cooking. But the tragedy behind this is, I'm asking her, well, what's the problem? You've already had your career, you're retired, you're taking care of your grandchildren and everything. What makes you want to take charge of this now?
Okay.
These things don't happen overnight. Someone's been dealing with this for a very long time and just kind of putting up with it. And she said, I'm really tired of eating in the other room. And I asked her what she meant by that, and what she meant was she had these, we call them flippers, party dentures, if you will, right? It's teeth that you put in to smile with, but you can't chew with them, right? So you have to take them out to eat, and she always felt ashamed being in front of her family, eating the food that she prepared for them. And so she would fix herself a plate.
Is that right?
She'd go in the other room, she'd take out her flipper, she'd have her food, and then afterwards she would come back to the table and she'd be all smiles with her flipper. And she kind of lived this this dual life. There was the one that was kind of hidden away in the shadows where, she was enjoying this food, but she didn't get to enjoy it with her family. And then she comes back in and asks everybody how it was. And so in one afternoon, we changed all of that. And so if you take a look at this with a combination of procedure.
Big difference.
Yes, absolutely. So you
I'm not trying to side with you, but I think it looks at this.
If you didn't side with that and say that's a beautiful picture and that's an improvement, then I don't really know what to tell you, because this is an entirely different person. This is a
you
person
say they
that
act differently? Because I like to think it's just teeth, but you told me, I guess those are fighting words, but it's more than that, right? You say?
Yeah. It's very. I think these pictures, it's so important to tell the story because they can only tell you really so much. And, in my practice, what I always say is I meet a person twice. I meet them when they come in for the consult.
Okay.
They tell me about their past. They tell me about all these problems. But really, I'm excited to meet them the second time. And the second time is after they've gotten this makeover, after they've had this whole new life for themselves. They're eating better. They're smiling more confidently. They're showing up in their lives to their friends, their family. Things are going better at work. And you know what? They're getting to eat their own food in front of their family. Even just those small things, that is going to be a different person. It's not going to be the person you met that first time. And I really enjoy meeting people the second time. So let me show you this next patient.
And I'm going to rush you a little bit because we're kind of short on time, but these are good photos.
Okay, rapid fire. So what we have here is Lindsay. So Lindsay is a wedding photographer. So her whole life is about going and capturing people's most special moment on their biggest day, taking tons of pictures. These people, if you've ever met them, they are absolute experts at getting someone to smile. They know how to make you laugh. They know how to get you to show out. But she frankly was an absolute amateur at smiling. She had no idea how to smile. You can tell in both photos. You're about to see the after. If you look at her before, she's straining to smile. It's not a very natural thing for her. She's not smiling with her eyes because she's never been happy with her appearance. She's been living behind the camera, and that's been sort of her camouflage, just being behind the camera, not being the person in center stage. You know, and she's walking around, she has infections, right? She has bad breath. Why does she have bad breath? Because those infections are active. They're actively tearing apart her bone and her gum structure and all these things. And so there's all this destruction going on underneath the surface.
So you have to clean that out.
Of course, yeah. So that's absolutely something that we have to take care of, and we always take care of that in-house. That's all a part of the process, right? And so throughout this process, throughout a combination of procedures, going in there, getting that infection out, getting everything nice and clean and healthy for her, we were able to establish
an extreme smile makeover.
New foundation, right? And so now another thing about this that's interesting. Now, of course, she's got a beautiful full white smile. It's gorgeous, right? It complements her face very well. When you're looking at her, you know, she's got this brand new smile makeover. It's this beautiful portrait of a thing, but then when you kind of zoom out and see her whole face, you can tell she still doesn't know how to smile. She's still learning this.
What do you mean she doesn't know how to smile?
Right. So you can see in the facial muscles, right? You can see when someone's smiling with her eyes, when it's authentic, when it's practiced.
So she's just kind of showing her teeth right now.
She's just trying to show her teeth.
That'll
She's trying to
soften
show
over
off
time?
what we did. But yes, I'm going to come back, and when I see her at her recall appointment, I'm going to take another photo, and it's going to be a totally different, more relaxed person that is confident in themselves, who identifies with this new smile, who identifies with someone who has a smile to show off of. And that does take some time. It's a lot. It takes more time than the procedure itself. You know?
Very nice. Very nice. Time for a few more.
Absolutely. So what I have here is Linda. So she is a nonprofit coordinator. So she kind of strikes to the core of something I run into with a lot of people. They have dental issues. They don't like the way their teeth look. They don't like their breath. They don't like speaking in front of people, but that is kind of the nature of her job. So she is a public speaker. You know, she thought there was going to be this long, drawn-out process, and there were going to be periods of time where she couldn't go up and talk to people and serve her community the way she wanted to. So she was absolutely elated to find out that we could fix all of these issues in one day. And so if you look at her after here, she is a very bright, vibrant person. She's showing all of her smile. She's smiling a lot more, right? We didn't do anything to her facial muscles or anything like that. We didn't touch that. All we did was teeth. But this person, that is the smile of a person that wants to show you what they've got. They've had that makeover.
So it's like a huge boost in self-confidence.
It's a huge boost in self-confidence, and of course that's going to manifest when you're speaking to people, when you're trying to inspire others. And so that was a really, really cool one to see.
Do you think it's like anything else in life? That means if something, you don't like something about yourself, it holds you back? Can you elaborate on that?
Yeah, so there's all these subconscious triggers, right? So anytime we think to ourselves, oh, don't talk too close to them, they might smell your breath. Don't try to bite into this apple, you know something's just going to break. It's all these little tiny nuances, these little misses in life.
You said it creates anxiety too.
It creates anxiety, and it keeps us from living a full life. It keeps us from being our full selves because we're always in this mode of holding back and protecting ourselves against these problems and not doing anything about it. And it's a real shame because so many people don't understand that this is something that can literally be taken care of.
So that turns around right away.
It turns around right away. It's one of my favorite things in the world to demystify for people, and it never gets old.
Okay, good. And I'm going to rush you again. We have time for a couple more. I know you have a stack left, so we won't be able to hit all of them.
I guess I got to come back again.
Okay.
But, yeah, so this is James. So he's another teacher. He's an English teacher. He's very well educated. Though his smile wouldn't necessarily suggest that to you, right? So
you think there's like an impression people with bad teeth aren't very educated?
You know, I say this not because I judge people for their teeth, right? I mean, I'm always very clinical about this, but I know this person has been judged. I know this is coming for them. They'll tell you that, but another aspect of it is if you're hiding your smile from me, I know that you've been judged in your life. You've been given a reason to hide that from people and to not make eye contact and to cover up even though you're not sneezing or just, you know, have excuses not to smile. And that's exactly what James was showing. And then, you know, when he is opening up a little bit more and he's showing his teeth, you know, he's telling me, he's like, I don't look like I have a master's degree. I don't look like a sophisticated person. I don't look educated. But he's, you know, he's
like in the movies.
Right.
Yeah. If they want to make somebody look bad.
Right.
They give
This
them
is the
bad
first
teeth.
thing they do is they make them false dentures, right? I mean, all the time. They have to put something in that makes their smile, frankly, look like that. And so people are walking around with their actual teeth being sort of a caricature of themselves. And so this was something that we were able to turn around right away. So just a few nuances that I do want to bring up because
Okay.
there are so many things that we can do. When you look at his original smile, you can see there's a little bit of an underbite. His lower teeth are coming out in front of his
Okay,
upper teeth.
okay.
They're also missing. Everything's chipped and things like that. We were able to correct that situation and get it to where everything was instantly better aligned, not just for the aesthetic purposes, but for the functional purposes. That's extremely important. And that makes a big, big difference in how these last over time, right? You have to have them functionally in the right place and coming together and working together in such a way that they're going to be able to do this for a long time. I love the before and afters. I love that delivery, but I love to see it 10 years from now, not just on that day. And so that's really important.
Did they ever say, I think you told me this, that they'll say, Doc, you've changed my life?
You know, I hear it all the time and it always makes me feel good, but I tell every person, I say, I didn't change your life, you did. You just let me be a part of that, right? So they made that call. They decided now was the time to make a change in their life, that they were no longer going to put up with all these problems, the bad breath, the missing teeth, the decay, the infections, all the things that their teeth were holding them back from. They said, you know what, I'm going to go to the office and I'm going to get this done, and I'm going to get this done in Tacoma, Washington with Dr. Tolbert, right? And that's something that I am extremely humble and grateful for, but it's never lost on me that it's the patients making this change in their lives. And this represents how they show up in the world, how they're smiling when they go on a date, when they're talking to their friends, when they're talking to their family, when they're trying to inspire somebody. They're now making changes in other people's lives and being able to inspire them to do something. So
how do most of these people hear about you?
Yeah, so these patients more often than not have done a lot of research. One of my first questions always is, how much research have you done? What do you know about this? Because sometimes they've already put in hundreds of hours.
So they've checked you out.
They have been looking all over creation for the right doctor for them, and they've come to me to see what's going to be possible. That's something I'm very proud of. They look at us on Google, they see my experience, they see all the people that I've taught, and they hear about experiences of work that I've fixed. I've fixed a lot of this kind of work as well, and they trust me because they know that I've been through this process so many times, and I care a lot about them, and I want to be a part of their transformation. So these people are very learned on what we do, and I certainly appreciate that.
Final message to a patient that has really bad teeth and gums, and maybe they feel hopeless. I mean, they're without hope. They don't think anything can be done. They've heard what you have to say, but for whatever reason, they're still afraid. They're still scared. Maybe they're worried about pain or whatever.
Sure.
What do you say to them?
Just come on in and let's have a talk. Tomorrow is this wonderful land where everything gets done, but if we've been saying tomorrow forever, we'll keep saying it forever.
Okay.
Make today the day that you decided to make a difference, right? That you got sick of all those problems, you got sick of the bleeding gums and the bad breath and the missing teeth, and you wanted to make a change for yourself. And you know what? There's no commitment to just coming on in, having a conversation with us and seeing what your options are. And I don't think you're going to find a better place than in Tacoma, Washington.
And if they want to make an appointment, do they go to the website, or you prefer they just call?
I personally prefer they call. We'd like to get to know every patient before they even come in. We don't want that to be the first introduction. We want to know why you're coming in, what you're interested in, what your biggest problems are. We want to know the change that you want to see in your life before you even come through the door. So I prefer the phone, but yeah, you can absolutely make an appointment through the website.
Great. I want to thank you for coming on the show.
Sure.
Good stuff.
Thank you, Randy.
Great
Thanks
stuff.
for having me.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.